Morning.
Morning.
Morning. Christy is on her way. I'll pull a chair around for her. Happy New Year.
Same to you.
Christy was looking at end of the year numbers, and we thought we may have that ready for you today, but turns out we don't. So I'll jump into the first item. I'm requesting a new position, staff social worker, in the alcohol and drug program. For the past several years, we have closely monitored units of service, which is the number that we use for billable services in our clinic. Each clinician has productivity goals, and each clinician is very aware of where they stand on a month-to-month in terms of their productivity goals. We use this information and several other data points to improve clinician performance and also inform our decisions regarding the quality of our services. I have some information for you that will, one is for alcohol and drug, the other is productivity for mental health. I think this will be helpful for you to see in terms of both programs and what we've experienced over the last couple of years. The graph represents, it compares what we call weighted units of service for years 2016 and 2017. Now, also keep in mind that we moved to open access in the outpatient clinic. And overall, this has worked very well in terms of serving the needs in our community. Providing immediate access when help is needed has improved our ability to engage individuals in the change process. So keeping the front door open has certainly factored into what we've seen in terms of productivity, the increase in productivity. The opioid heroin problem has also been a factor in the increased demand for our services. Moving forward, as we move into a pay-for-performance environment, or otherwise known as value-based payments, we know we must continue to have open access. At this point, we're in a position on the ADAS side where clinicians' caseloads are way above what OASIS requires, and we're in a position where it is compromising now the quality of care for those individuals who are receiving treatment. The best way to explain this is when individuals come in for treatment, it's recommended that they be seen at the beginning of treatment multiple times during the week. Caseloads are so high and schedules are so packed that it's difficult to get people in as often as they need to get in through the course of treatment, because again, that front door remains open. And also, we're then losing opportunities to generate revenue by providing fewer services or fewer services than what is clinically indicated. I realize that when you're looking at these two graphs that mental health appears to be the area of greatest need, but please remember that we are serving individuals with co-occurring, so individuals who are in need of both mental health and substance abuse, we're treating them on both sides of the clinic. For this and for the next agenda item, I want to remind you that over the past several years, I've consistently adjusted levels of staffing based on the presenting needs in the county and also based on changes in funding. I believe I've maintained a good balance between my role as the LGU, where I'm responsible for the planning and monitoring of services in the county for individuals who have a mental disability, while also considering any financial risk and exposure these services represent for the county. We have a breakout of
I didn't bring it with me.
Oh, I'm sorry. Okay, we have a breakout of the cost of the the position with fringe, the associated revenue, and the position, I'll have that, of course, if this moves to finance, I'll have that for personnel and finance. But the revenue produced by this position would completely cover the salary and fringe. Do you remember roughly what that was? For the social
It
workers?
was about 95,000.
Ruth, just a question, is it the opioid or epidemic getting worse, or are people just saying, hey, I want to help? What do you think?
I don't know that it's getting worse here in our county.
But the numbers have jumped from 16 to 17, so, you know, obviously there's,
Oh, in terms of productivity?
yeah, as far as people coming in, is it people want to get help, or is it just, yeah, or is it just that the epidemic is getting worse?
I think it's probably a combination of both. I would say less getting worse because we haven't seen evidence that the problem is getting any worse. There does actually seem to be some indication that heroin use and opioid abuse has gone down, but we're also concerned about the uptick in meth and meth use. So, but as far as people coming into the clinic asking for help, that has happened, and that continues to be the case.
Just a question is, are people going from like heroin to meth, or are the new users getting into meth?
Probably a little bit of both.
I think it's definitely something we need to look at, and you know, definitely,
So
in order for it to get better, this kind of things are gonna happen, you're gonna need more personnel.
So I'm requesting an additional staff social worker to be assigned to the alcohol and drug program in order for us to meet the current substance abuse treatment needs in the county and also move into compliance with OASIS caseload quality recommendations.
you said that the effect of the budget would be neutral, basically, at the local level. Yeah, sounds like a good idea.
Just
Actually,
like with the
local-
high school, when they brought in counselors, I mean, at first it looked like it wasn't budgeted, but it turned out to be paid for.
And I apologize, we don't have those numbers for you in front of you, but the local share in that program will actually go down slightly by adding.
Do you have any open lines as far as staff social workers, or this would be a new line?
Yeah, it would be a new line.
Do you have to go to finance to initially get the monies before you start getting reimbursed, obviously, right?
I have to go to personnel and to
To
finance.
Do you know what the initial startup for having this position would be? I mean, that you'll be requesting, because you're gonna eventually get, before year end, you're gonna get reimbursements, but I mean.
Right, but we would have to do a budget modification to add this position, add the expense of the position, as well as add the revenue.
Yeah, do you know what your total request would be at this point? 50,000, 60,000?
Well, for the salary plus the fringe,
Yeah.
it's about 91,000.
And I think what we were looking at this morning, the revenue associated with that position would be roughly 96,000.
So you'll be spreading out some of the work, taking load off of some of the other ones? Or is there's just that much more?
There's that much more work that needs to be done. And those individuals who are currently receiving treatment will get the right amount of treatment that they need right now.
Motion to refer to personnel.
I'll second.
Any other discussion? I know you haven't said, or you said that you didn't have your year-end budget review done. You gut feeling about what that looked like?
ADAS had a very good year, good or bad. So I believe the county share will be lower than budgeted. Mental health, I haven't got through yet, but it looks like we'll probably be right at budget. And mental health schools was to the positive as well.
Any other discussion on this? All those in favor of moving it to personnel?
Aye.
Opposed? Carries.
So the next item is a request for a new position, again, community mental health nurse, and this is on the mental health side for budget. For the past couple of years, I've shared with this committee the increased focus and demand to integrate physical health and behavioral health because it is all connected. There are changes now in primary care settings where behavioral health screenings are taking place, and similarly in our behavioral health setting or clinic, we're now required by both OASIS and OMH to gather, assess, and refer individuals who are in need of physical health care. DOH, Department of Health, has consistently communicated the expectation to coordinate, communicate, and integrate care across the healthcare system in order to improve overall health outcomes. True integration eliminates waste and decreases expenditures. This is particularly a concern for the Medicaid population, which is our largest population served in the outpatient clinic. We currently have one community mental health nurse, which is an RN, for 1,126 patients on any given day. Mental health has about 860 on any given day, and ADAS 266. We currently cannot keep up with what is now required by OMH and OASIS in order to gather physical health information, assess, monitor, and refer. So this is another area where there is a compromise in the quality of care. Additionally, with more and more individuals covered by managed care, there are additional clinical requirements to obtain pre-authorization for treatment that can only be provided by a medical professional. Our antipsychotic injections continue to prove to be highly effective for a growing number of individuals who are living in the community, and these injections can only be administered by a RN or a nurse RN. We anticipate the need for an additional nurse, and we included this in our Vital Access Provider Grant application, which we submitted a couple years ago. Okay. We've held off until now to request an additional nurse position in our staffing because we wanted to be certain that position would be sustainable once the VAP grant ends. We're confident that once the VAP grant ends, that this position will be entirely supported by the revenue it generates. For 2018 and the first quarter of 2019, the VAP dollars will be additional dollars to the overall revenue generated in the mental health outpatient clinic. At this time, we're requesting a new position, community mental health nurse, in the mental health budget. And again, I'm sorry we didn't bring the expense revenue worksheet. I'll for sure have that at Personnel and Finance. But the revenue that this position would generate, again, covers the fringe and the salary. But we'll have some extra dollars in this year and next because of those dollars that we can now bring in.
What is this position? What is the cost to fund this position?
Approximately $80,000.
Now, is there reimbursements that the county would be receiving for this too?
Yep. For 2018, first quarter of 2019, the VAP grant would cover 100% of the cost. After that, the fees that this position would generate would cover more than 100% of the cost.
And the VAP grant is how much right now? Is it?
The total, it's about a little over $400,000.
I'll make a motion to refer to personnel.
I'll second it.
Any other discussion on this? Questions? All those in favor of moving it to personnel?
Aye.
Opposed? Carries.
So 'tis the season for contract renewals, several. Catholic Charities, the total amount for the contract is $311,048. Catholic Charities provides the Children's Health Home, the Adult Health Home Care Coordination, and also does our supported housing for individuals who have a serious mental illness.
We could go over all 5 of those or whatever, because they'll end up on the same resolution
Right,
anyway.
okay.
So.
Are there any questions about
Is
that?
that a change? Is that an increase?
It's a decrease to the budget.
A decrease to the budget?
Okay, to move on to RSS. Rehabilitation Support Services, the total contract is $1,004,145. There are several programs that are currently in the RSS contract. Crisis Outreach is one. The ongoing integrated employment, affirmative business, otherwise known as serendipity, is in the RSS budget. Engagement and transitional support services, those are services we provide in the jail that works with individuals who are getting ready and transitioning back out into the community. Forensic crisis intervention, those again are services that we primarily provide in the jail. We also do some outpatient work in the clinic, providing treatment for adult sex offenders and domestic violence. We have an adult and children and youth outreach care coordinator. Psych Social Club has one position in the RSS budget, and SPOA, single point of accessibility, is in the RSS budget.
Just a question, Ruth, on the rehabilitation for basically folks that have been incarcerated, here at the county. Do you have a staff social worker also that works with those folks to kind of, you do?
Yes, and that's in this contract. We have a full-time social worker that's assigned to the forensic program. And also we have one full-time transitional, somewhat of a case management type position that also works primarily with the forensic population. And then a peer position, a full-time peer position. That's an individual who has life experience, has learned as a result of that life experience, and is now able to assist others.
Do you see any payback or any type of, improvements in the numbers that are people that get out that may get incarcerated because of offenses, the same offenses, or are you seeing, success with that?
We believe that we've already, and this transitional program is rather new. We believe we've been successful with not all individuals, but there's a growing number of individuals that's been successful in not having rearrests, not ending back up in the jail. But I think it's a little bit early to say for sure how successful that program is, but we believe, we're already seeing the results of offering those supports, particularly as they leave the jail and they're back out in the community. Things can go south real quickly for some of these folks.
So how long has that program been in effect? You're saying it's early.
I don't even think it's been 2 years yet. I used some OMH reinvestment dollars that came to us as a result of inpatient bed closures, and decided that was an area where there was a lot of need. So I used those dollars to create that program.
And what's the local share for these? Well, I'll ask at the end of all these contracts what the local share is.
There is none. This is all state aid.
Okay, to move on then to CCSI. CCSI, and then also there's the CCSI VAP, so they're two separate contracts. CCSI Care,
Coordinated care services.
it's who Christie works for. The contract is, for fiscal support, $66,670. That's what we budgeted for 2018. The CCSI VAP contract
That's what's in the budget.
is, in the budget is $80,192. The CCSI VAP contract are those services and trainings that we're getting, and we're using that to get our programs in our clinic ready for value-based payments. And that's moving along. Any questions on CCSI? Central New York Services, this is my medical contract, $325,353.28. That allows me to purchase psychiatric services for the outpatient clinic. And then lastly, I have two separate contracts with PhD level psychologists. One is with Christine Rackley, the other is with Sally George. These two psychologists provide psychological evaluations and when needed, but primarily complete what we're required to provide with the 730 evaluations that determine capacity, whether or not an individual has the capacity to understand the charges brought up against them and if they can actively participate in their own defense. We're required to complete those 730 evals, and it requires a PhD level licensed psychologist.
Okay, you looking to move those to the full board?
Just a question about seeing why the psychiatric service is purchasing that. So that's to pay for the psychiatrist?
No, there's a full-time nurse practitioner in psychiatry and then a part-time physician.
Because we bill for service, or they service as a bill for that.
That's right.
So do services billed equal that amount, or?
Yeah, the fees cover their cost.
Just out of curiosity, is there a dollar amount associated with consulting psychologists?
They have a fee. They each have a fee schedule. It's slightly different depending on the item that's requested. But for example, the 730 evaluations that I just mentioned, they're $300 a pop.
What's the total, all the budgets, do you know? You said there would be a decrease overall for all the
I
budgets.
can get that for you.
So we need a motion to refer this to the full board to
Yes.
authorize the chairman to sign these contracts.
Yes.
I'll second.
Any other questions on any of them or discussion? All those in favor?
Aye.
Aye.
Opposed? Moves to the full board.
The next item is OASIS Prevention Contract with Lord Substance Abuse Prevention Services. As I mentioned way back in 2008 or 17, I was informed by Senator Axhar's office that we will receive a one-time only award of $70,000 to be used in a school-based substance abuse prevention program. At this point, Chenango County will act as contractor with OASIS to bring those dollars in, and we will be subcontracting with Lord's Prevention Services to actually provide the programming. The county attorney has reviewed the OASIS contract and is assisting me in the subcontracting process. I'm requesting permission to enter into a contract for these services with OASIS, and I'm also asking permission to subcontract with Lord's Prevention Services,
This is for the one time.
the one shot only.
Is it gonna go into schools?
Yes.
And is Norwich, City of Norwich?
They are currently not on the list. The superintendent had some other changes that was happening in the district, and he wanted to wait until the fall, and then actually the county-operated school-based prevention program is likely and hopefully will be going into the Norwich schools.
Is there any follow-up with him to find out if he's looked to, to maybe have this come in or what? This is odd.
Matt Skojak, he's the coordinator of the drug and alcohol clinic side. He and I met with Gerard
Also,
O'Sullivan, and towards the end of the last year. And at the time, they were very interested in school-based prevention services, and we were interested in moving into the Norwich City schools because we have our mental health satellites there as well. But as I said, he's had some other changes, and he preferred to put that off until, I'm hoping we'll kick it off in the fall.
so you have something set up and ready to move in there?
Yes.
And how soon would these move into the other schools?
As soon as we get the contracts in place and get those turned around, we can begin to provide that programming. Right now, they're scheduled to go into Afton, Bainbridge, Greene, and Oxford. And it's, I believe it's a 6 or 8 week curriculum. It's called All Stars. It targets the middle school age students, because that is generally when things start to really percolate. So it's an evidence-based curriculum that gets good results, and so that's the plan at this point.
I'm just very concerned, I'll tell you what. Probably 2 weeks ago was that night we had the 60-degree weather. It was a Thursday night, and then Saturday was below zero by then. But it literally was just opening up the window to our house. I live on the end of York Street, which is literally I can throw a snowball and probably hit school property. Actually, my side lawn butts up into the school property. I opened up the window and I hear somebody panting. I hear foot tracks or somebody jumping, walking or running on my property. And I'm getting ready to find out what's going on because he's right outside my window. And next thing you know, there's 2 police officers following this guy. He slid on the side hill, which is the school property, and he was from Endicott, and they ended up arresting him. But it's just a matter of this stuff is right there, the junior, senior high school. I just trying to understand what the rationale is.
Well, as I said, we're
It was
very
because
much
it's
hoping
no
we
cost
can
to
get
the city
into
school, is it?
There is a small cost, but it's not. I did not get the sense that budget or dollars were going to be a barrier. I'm very confident we'll be able to get those prevention services in, certainly by the beginning of next school year, which August, September.
Just one further question is, it sounds like it's all at the southern end of the county. Is anything UV or Sherburne or Oxalic or?
When I identified those areas, I identified the areas where our current school-based prevention program is not serving. So for that reason, it is possible that these dollars will become more permanent as anything is these days. But at this point, it's a one-shot deal, and I have to treat it as such. It is possible in the future that these dollars will be added to our state aid, and we can then expand our current school-based prevention program.
I make a motion to move this way. I think it's something that's definitely.
I'll second.
Now, this needs to go to finance because it's a change in the budget. This is new monies that you didn't know about at budget time.
It is. Would you recommend that we do that this time? Yeah.
Move it to, make a motion to finance.
And then we got a second. Any other discussion on this? All those in favor, move it to finance.
Aye.
Aye.
Opposed? Carries.
So the next item, this came in really late last week, data use agreement. I'm requesting to enter into this agreement. It is a legal arrangement. The county attorney has reviewed it, but I will need a county resolution in order to enter into the agreement. New York State Department of Health, DOH, and Chenango County LGU wish to improve care and reduce costs for Medicaid recipients in need of and utilizing services funded by the New York State Medicaid program. DOH, along with OMH, OASIS, and OPWDD, the Directors of Community Services, or LGUs, have set standards for and monitor the quality of behavioral health services provided to the Medicaid population. LGUs receive statewide access to the Medicaid Analytics Provider Portal Health Home Tracking System. That's a mouthful. And I'm requesting access to this portal for the purposes of notification, referral, and linkage of these high-risk Medicaid recipients to a health home. So as the LGU, in Chenango County, I'm asking permission to enter into this agreement in order to obtain data from the MAP-HHTS portal.
There are costs to this.
There is no cost.
There's no special equipment needed to do that or anything.
No. I'll be given, I have a token already, a secure token already set up. I'll be given access to this portal.
And just for my own edification, LGU is local government
Unit.
unit.
Yep.
Okay. Don't mind me.
So,
Motion to allow, does this need to go to the full board? Motion to forward this to the full board.
I'll second.
Any other questions or comments on this? All those in favor, move it to the board.
Aye.
Opposed? Carries.
The last item, I've come before this committee a few times for the same request. I'm once again requesting a departmental credit card. We've had a situation a couple of weeks ago where we needed to make a purchase. The only way to do it was using a credit card, and I had to spend a lot of back and forth time in order to borrow Betty Osborne's card so that I could proceed. And I'm respectfully requesting that we have a departmental credit card issued. It's my understanding that several other departments have them, so there must be some procedures and there must be a policy in place. I haven't asked RC about that, but I think it's time.
It's become necessary at the town level, I'll say. To save money on purchases of many things, we have to have a credit.
We need to refer this to finance.
Yeah, these three.
Motion to refer to finance.
I'll second.
Any other questions or comments on this? All those in favor, move it to finance.
Aye.
Aye.
Opposed?
Well, we got through it.
Yes, we did.
So if you don't want those, I'll take those. Have a good day. Oh,
Thank you, Ruth.
Got just a minute. Ruth?
yep. Do you want me to stay or wait for you out
Yeah,
here?
I'll just.
Okay. Will do.
Unless we are.